My name's Katherine McNamara, and I am an assistant professor at the Cal State Northridge University in the Department of Environmental and Occupational Health. I went back to school, kind of mid-career. I'd been working in as an industrial hygienist for a while. And I was interested in learning more research methods and some of the science foundation that would help me evaluate some of the exposure thresholds that we use to protect worker health. Academically, I learned a lot from the first class I took from Dr. Q, where he had us research all of the exposure limits based on the literature that was available at the time they were established. And so that put everything into context for me, where I saw the limitations of the health data that our regulations were based on. And then through the program, some of the more valuable things were the journal club was really valuable in learning how to critique other people's research. The trips to Irvine to do the clinical case conferences was very useful, interacting with their faculty and physicians and sometimes their patients at the occupational health clinic, and looking at how exposure data was interpreted and applied in the clinical setting was very valuable to me. I think the diversity of activities through the ERC training practicum, so the grand rounds, the journal club, the site visits, it's all very broad and practical in terms of your exposure to different aspects of the profession. And then I really needed to develop my skill in data analysis, data management, some programming, and epidemiology. So I was able to do that through the coursework in the program. I got a lot of value out of, I applied for every possible internship opportunity. And so the opportunities that came through the door at UCLA to go work in the county health department, I did an externship at Cal EPA one spring break. And so there were a lot of little things that I benefited from professionally while I was here. I got very fortunate that I was able to land a tenure track position in the Cal State system. That was available right when I graduated. But I've been keeping an eye on the job market for a few years, and so I think this was just like a right time, right place thing. But I will say that because of my experience here at UCLA and the relationship between the campus I'm going to and UCLA, my experience here facilitated that greatly. I think it's technically very strong. Taking advantage of the training grant is amazing. I was able to be the PI on a pilot research grant through the ERC and also through the COEH. And so being able to get experience writing a research grant proposal and even managing the funds and acting as a student PI was very beneficial to me professionally. I think there's a lot of opportunity in the School of Public Health to diversify and also get some depth in different subject areas. And then the relationships I made here helped me professionally kind of set a new course. So I benefited a lot in terms of where I was when I came in and where I'm going now that I've graduated. You can pursue a project that's really in your interest area. The faculty are supportive of that, and you have to be a bit more resourceful to try to accomplish those goals and overcome the normal challenges for any dissertation project. But the faculty here are very supportive, and so there's a lot of opportunity that you can take advantage of.